Imagine a patient sitting in the chair saying, "These folds were already treated," and they came back again. Familiar? I hear it very often during consultations. In this episode, I'll show you a different way of looking at nasolabial folds. Not as lines to fill, but as a symptom of skin quality and tissue support. Work with the patient you'll see here began 2 years earlier. She already had PDO threads placed back then, which I'll talk about in episode 3 as a continuation of the therapy. Now she has returned with the same concern. So let's start with a key question. Why do nasolabial folds so often return, even though they've already been filled? In the second stage, I move on to working with the cannula to evenly lift the upper part of the fold and improve the contour near the nasal ala. I'll explain the general approach now, and on the following slides, you will see it in practice. I use the MicroBolus technique with a 22G 50mm cannula. The entry with the introducer needle is done flat, and the entire injection is performed in the subcutaneous layer. Each deposit is about 0.1 milliliter, placed as a bolus. I do not withdraw the cannula while injecting. In the upper part of the fold, I secure the infraorbital foramen by supporting it with the fingers of the opposite hand, and I turn the cannula opening away from it. This allows me to work without risking unwanted product migration. When inserting, I hold the cannula by the barrel, not the plunger wings. The other hand stretches the skin for full control over direction and smooth movement. After completing the second stage, I gently massage the area near the nose to distribute the product evenly. I also check sensation in the nasal ala and the corner of the mouth to ensure there are no concerning signs. Finally, I assess symmetry and the smoothing line. If you enjoy this content and would like to watch the full episode, register for free on VOD Vismed Online and get monthly access to the latest knowledge based on research and real clinical work with patients. You'll find the link in the description and in the pinned comment. Additionally, with the code START, you can access your first month for a symbolic 2 in your local currency.